So, as this topic of obesity is being discussed today, this is an extremely important topic because not only it causes harm to various organs of the body and causes problem, mortality, morbidity, but also that it is also treatable. So, something which we have to look for things which are treatable, which are correctable, and then we can focus on that. So, if you see the almost the studies have shown that almost 1/3, even in some urban area, 40% of population is obese. In a rural area, also about 20% they are obese. These are the current figures for India. So it's a very big number. That is what we need to understand. Then the common thing, what people ask you, what is obesity? People ask, what is obesity? How to know I'm obese or not? So there are certain very simple things to remember. The most accurate way is the body mass index. And these days, apps are available. You can download an app on your phone, just enter your height and weight, and you will get a body mass index. And body mass index should be preferably less than 23. 18 to 23 is thought to be normal. And certainly less than 25, because Western population, they take 25 as cutoff, but we take 23 because we are more prone to obesity-related problems. So, a very general rule of thumb that previously used to be said about obesity, you take your height in inches. Suppose you are 5 feet tall, so your height in inches is 60 inches. So, the weight should be around 60 only. It's a very easy thing. If your height is 70 inches, the weight should be approximately 70. So, a very gross rule of thumb which is there, which also is useful. It's easy to remember, and therefore one can easily apply also. And then there is also a method, waist circumference. There's a waist circumference, that's also good index. Everyone knows their trouser sizes, etc. So for men, it should be less than 40 inches. And for women, it should be less than 35 inches. So it's again very easy to remember. 35 and 40 inches your waist should be less than that. And in centimeters, it comes to around 90 centimeters and 100 centimeters. So it's just that one should remember. So, and especially if you see there is a condition called metabolic syndrome, which has, various these lifestyle disorders like diabetes, hypertension, and that has obesity, that has waist circumference as a definition in that. So that is what is kind of, important. And different studies have also shown that it's the abdominal obesity. It's that increase in the waist, which is more important as compared to the overall weight, because if the weight is more around hips and thighs, etc., that is less harmful as compared to weight that is around in the abdomen. The protruding tummy, that is what is harmful, and therefore this has to be kind of looked at more carefully. So then the various organs of the body get affected, various diseases get affected by it, and I'm going to focus more on heart diseases and cardiovascular problems. And the two certain things are hypertension, that is high blood pressure. And of course, coronary artery disease, which is like angina and heart attacks, mitral infarctions, etc. So very often we see the patients who have got high blood obesity, when they reduce their weight, their blood pressure comes down. This is well documented. This is one thing which we advise to all our patients who have got hypertension, that they should attain an ideal body weight. With that, the requirement for drugs go down. Sometimes they don't even need any drug at all for if the hypertension is not very high. So, and that's the important thing. Secondly, this obesity is often associated with high cholesterol in the blood, and that leads to atherosclerosis, coronary atherosclerosis, and that leads to angina and heart attacks, etc. So therefore, that's as everyone knows that angina, heart attacks is a very major problem and leads to significant morbidity, mortality, and this also leads to heart failures. So patient heart failure also we advise them to attain an ideal body weight. Because more the weight, the more is the load on the heart. The heart has to pump that extra volume of blood for every extra kilogram of the body. And therefore, it's important to control the body weight for that. In recent years, even the rhythm problems of the heart, atrial fibrillation, that is also becoming more common. That is, especially with our aging population, it's more common in elderly. And therefore, rhythm problems are there. And there also we have found that those people who manage their lifestyle and they reduce their body weight to ideal body weight, reduce from obesity to ideal body weight, their rhythm problem also goes down. So otherwise, atrial fibrillation is a little difficult thing to treat. So that is the other way. So therefore, there are a lot of things. So I've also on cardiovascular disease, but of course there are other diseases like cancer, and diabetes is a very major one, and even social problem. I think subsequently we will discuss even more. So this is in brief about the cardiovascular disease and the effect on the cardiovascular, obesity on the cardiovascular disease. Thank you.
Good afternoon, everyone. A lot has been said about obesity. Now, one thing is that obesity is now considered as a chronic progressive disease. Earlier, it was thought as only a cosmetic problem or something which needs to be taken care of. Now it is clear and it has been agreed by everybody that it is a chronic and progressive disease which can have ill effects on every organ system of the body. Heart is one, liver, the kidneys, the joints. It can affect every major organ system of the body. And having excess fat in the body, fat mix, that's called obesity. So what is peculiar with our Indian population is that we tend to accumulate fat over the abdomen or the belly, much more than our Western counterparts or Europeans or Americans. So a person of the same age, same BMI, of European descent will have less body fat as compared to a person who is of Indian origin, or me or you. So that is the problem with us. We tend to accumulate more fat as compared to the rest of the parts of the rest of the components of body composition, and we tend to accumulate more fat at the belly. So that is the major problem with our population, and that is the reason that body mass index, the universally accepted parameter to define obesity, there may be a problem with that, particularly in our population, because BMI is your higher weight divided by height, and that does not take into consideration how your body fat is distributed. A person who has a large amount of belly fat will have the same BMI. On the other hand, an NBA basketball player having everything but having a lot of muscle and just maybe 10%, 12% of body fat will have the same BMI, but that person is not at any risk, whereas the person with high body fat or high belly fat is at a higher risk of developing problems. So that doesn't differentiate very well. And that is the reason that another measure, like as Dr. Narang said, waist circumference. Your waist, how big is your waist? That is a very important parameter to differentiate, because if the BMI is less but your waist is more than the norm of the particular ethnic group, because waist circumference is not same in all ethnicities. Different cutoffs are there in different populations. For Europeans, it's different. For Japanese, it's different. For Indians, it's a different cutoff. So it depends on the ethnicity. And if, as per the ethnic group, if your waist is higher than the cutoff, then you are at a risk of developing problems, even if your BMI may be all right. So that is a very important thing. Another measure is, once you have your waist, so another measure is waist by height. A simple measure. You measure your waist, you add your height, divide your waist by height, it should be 0.5. That is, keep your waist half of your height to remain healthy. Now, if that is there, then
centimeter.
Whatever it is, the unit, whatever. If your waist, you take it in inches, take height in inches. If you take it in centimeters, whatever may be the measure, but if you keep your waist half of your height, that's good. Then you will not be at a risk of developing cardiac problem, metabolic problem, and all these sort of things. And that is something which is important. And lately, there has been a paradigm shift in how you define obesity. Like, you must have come across many people. They say, I'm obese as per the BMI, whatever, but I don't have any problem. I feel perfectly healthy. My blood pressure is okay. My lipids are okay. My sugar is okay. I feel energetic. I exercise. Everything is fine. I don't have any problem. But that is a stage. Now with the new definitions, that may be a preclinical kind of obesity. where you are obese, but you haven't developed any clinical problem as of now. But this is a temporary phase, I would say. This does not remain for a long time. Now, over a period of time, this individual, if does not take care about it, can go on to develop clinical problems. So now that is why internationally, as well as the Indian consensus, which has been recently published, that there's one stage where there is a preclinical obesity, the second is the clinical obesity. So in preclinical, you have to be careful. You have to avoid going on to the clinical. And once you develop the problem, then you have to manage it. So obesity is one thing which is a preventable problem. Constitutional obesity is a preventable problem. There are genetic causes of obesity which are seen generally in the children, not in adults. In adults, almost the majority of the problem of obesity is constitutional. It's preventable unless an individual is on some drugs, etc., which may cause lead to weight gain. So that is why it is a mother of all large number of non-communicable diseases, even cancers. Several cancers have been associated with obesity. So it is one thing, if you prevent it, manage it properly by your diet, lifestyle or medications. So lifestyle changes, diet and lifestyle changes are the pillars of management. Everything else, maybe the medications, maybe the surgery, whatever is there, that comes after that. If this pillar is not there, nothing else works. And this is a preventable problem which can lead to prevention of so many non-communicable diseases. And why it is to be taken seriously, I'm glad it is being taken seriously right now, is because our healthcare system, now we are the diabetes capital of the world. Now recently China has more numbers, but we were the diabetes capital of the world. So they had so many patients with diabetes, and incidence of cancer is increasing, incidence of heart disease is increasing. And that too, this is happening in every age group. Now, obesity is seen in every age group: children, adolescents, young adults, elderly. So it's affecting all the age groups, and it is affecting all the socio-economic status. Rural population traditionally was hardworking, very less prevalence or incidence of obesity, but now it is increasing. You see the reports of National Family Health Survey 4 and 5. There's a significant jump in the prevalence of obesity even in the rural areas. So the changes are happening everywhere. The urban, rural, and the population who are migrants, rural to urban migrants, that is one population which is badly affected, or the so-called slum or urban, the migrants, who a large proportion of them end up living in the urban slums. So that is a population which is exposed to the most unhealthy diet, most unhealthy lifestyle practices. So this situation is happening everywhere, and if it's not controlled adequately or quickly, there's going to be an explosion of non-communicable diseases. And then that may overwhelm our healthcare resources. And obesity is not something which needs to be managed only at a tertiary care center or a specialized center. No. It has to be, everybody, even a doctor sitting in a PHC in a rural area should be aware about it. That this is a problem, why it is caused, and how to manage it. And up to a great level, prevention, management and awareness can be done at that level itself. It doesn't need to be a sole area in the urban cities like Delhi or a tertiary care or specialized sector. So that is the reason I think awareness of everybody about what causes obesity, how to deal with it, how to prevent it, and how to manage obesity and prevent developing problems later on. I think that awareness is very important, and it's happening at the school levels, at the college levels, even at the general population level. Now that is extremely important.
Dr. Narang and Dr. Naval has covered a large part of what I wanted to say. but I think so I would just, elaborate some things more on the one is the utility and sometimes the futility of using BMI. Remember that obesity is a lifestyle issue. It is not, not merely related to just an excess calories. It encompasses many things. It may encompass personal behaviors. It may encompass levels of physical activity. It may also encompass ease and accessibility to food. Do remember that access to good quality food is not so easy. It's always easier to pick up a packet of chips, a packet of biscuits, and do that while you're traveling or you're in a place of work or in your offices. It's much easier to get access to a banana, an apple, or an orange, or cucumber, or a salad for your meals. So that's one of the problems. That's why we call it a lifestyle disorder. It is something that we are continued to expose to from childhood to adulthood. We always have access to food that seems very cheap. It seems very accessible. That's easy to take, and and you're forced to live the way you are. So obesity essentially has become a modern lifestyle disease, and like everybody said, it is progressing to the point that it starts from childhood, and it's very difficult to get rid of. Remember that obesity has many things that that make it difficult for us to treat it, because it's not something that you report, right? It's just sort of like a tick box that you say he's obese, but what are you doing about it? We are really, as doctors, not being able to systematically address this issue. And this is something that we address only at the very late when they are morbidly obese. People come for bariatric surgery. They're coming to endocrinologists because they've developed diabetes. They're coming to us because they've developed heart problems, stroke, heart failure, so many things. But we're not addressing it early on, and that is something that we really should work upon. And that will obviously encompass all these things that we have talked about. So it is an inflammatory state, and that fat has different components, and some fats are good, some fats are bad. Remember, how we assess it is also something that we are learning to do now. BMI is what we used, but like we said, BMI cannot be an absolute tool, because what does that say? It just says height and weight, right? And weight doesn't get taught which type of weight. Is it muscle mass or is it fat mass? So, weight can be, for example, they can be a wrestler who has got a lot of muscle. Muscle has weight that's more than the weight of fat. So his BMI may be 25, his BMI may be 26. So that is not accurate, because he's muscular. Whereas there's another person who's an elderly gentleman whose muscle mass is less. His BMI may be normal, but he's making up that he falls within the normal, because his muscle mass is less and it's all made of fat. So his BMI may be normal, but he may not be well. He may not be healthy. So because it's all fat. And the distribution of fat is important. We didn't understand which all fats are, locations of fats are good or bad. Generally, fats around the belly is not good fat. Because that fat, one is the ones you can put in your abdomen. That is subcutaneous fat. But there's a type of fat that lies around our organs. That's called visceral fat. Some amount of visceral fat is good. There are types of visceral fat that are bad, that are inflammatory and lead to all sorts of conditions. That, like we said, we can have heart diseases. You can have various types of cancers, all types of endometrial cancers. You can have breast cancers. You can have colorectal cancers. You can have gallbladder cancers, and all the works. And many other, muscular disorders, skeletal disorders, cardiac, neurological. So many things are affected by obesity. And therefore the treatments are very difficult, but do realize that obesity is something that people don't really come up to us to ask, what can we do? And that is something where nutrition plays a key role, physical activity plays a key role. Remember that all obese are not necessarily bad, as Dr. Naval said. People, if they can be healthy, while they're obese, they may be physically active, and that's a stage when it's reversible. You can get rid of it, and getting rid of it is never too easy, because the body militates against you when your sugar levels are low. When you take a low calorie diet, what happens is that your body hormones surge and work against you, and sometimes very difficult for you to maintain what is an optimal weight. The body sort of pushes you back into obesity, And that is something that, has to be done systematically with the help of, everybody. It's not a personal disorder. We sometimes take it as a stigma that guy is obese and it is his personal problem. It's not his personal problem alone, because the society in some ways has contributed to him becoming what he or she has become today. So, but yes, it is very important that we systematically address it. We take care that in the families, everybody is involved in the game, that we cut off calories where they are not necessary. We eat food that's healthy. We access food that's healthy, and we make sure that healthy food is available in our environment. Remember, it's very strange to see that in the less privileged environments, often you'll find more obesity. And the reason for that is no departmental store will open up in a under privileged area, because you can't sell fruits and vegetables over there. But it's easy to sell a packet of chips, a packet of biscuits, a Coca-Cola, or a beverage, or a carbonated beverage over there. So these are things that we all need to address. It is something that is society's responsibility, that we address obesity as a whole, as a complete package, and not as an individual's personal problem.
Good afternoon all. So you might be wondering what I am doing here, because we are talking about the oil. हम तेल की बात कर रहे हैं, but तेल से भी stress का relationship होता है, and we call it oxidative stress. You all know that. But no, we talked about obesity, BMI and all that, but it's important to understand obesity and the risk of the oil is much more than BMI, what Dr. Nitish has pointed out. And stress has a major role in obesity also, plus other health factors also. I will just give an example. A lot of time it happens that our diabetes endocrine people, our colleagues, they send the patient to us because they have used all the medication for diabetes control, but the patient not responding, and still diabetes not controlled. And that is mainly because of the stress. So the stress, you all know, when our body's resources is not able to cope with what the body or brain's demand is, then there is a mismatch. And that mismatch is the stress. So stress is not basically external, it's internal. It's your mismatch, not the mismatch of the environment. So the stress is so important. Like, if you do some, we have seen some studies and research, it's almost established clear that a lot of obese people, they are not overeater, but still they are obese. And that is because of the stress factor. Because what happens with the stress, if the stress is there and that is not controllable stress, that leads to increased level of glucocorticoids. तो जब भी cortisol बढ़ता है blood में, तो sugar भी बढ़ता है and fat release होता है. So once the fat get released, that get deposited, and what we have mentioned recently, the truncal obesity. So one of the important signs of the stress-induced obesity is truncal obesity, and that we can perhaps pinpoint if the stress is there. Another important study that has been conducted is like half of the patient who had the stress-induced obesity, that can be basically ruled out, and that can be ruled out by just simple test like hair cortisol level. तो हम हेयर का सैंपल लेके कॉर्टिसोल लेवल देख सकते हैं, तो जिसमें कॉर्टिसोल लेवल हाई होता है, तो दैट मीन्स कि द चांसेस ऑफ द स्ट्रेस इंड्यूस्ड ओबेसिटी इज मच मोर, एंड अनलेस वी कंट्रोल द स्ट्रेस, सो द मैनेजमेंट परहैप्स विल बी डिफिकल्ट फॉर द ओबेसिटी एंड अदर फैक्टर्स दैट इज रिलेटेड टू दैट लाइक डायबिटीज, hypertension and so many. What we see, like emotional eating is much more. And mostly the comfort food what Dr. Nitish has mentioned. So those food which is comfortably available. And most of these are processed food. And when we take high glycemic food, as a processed food, the obesity is more because there is a more and more sugar and the fat. So in emotional eating, mostly we eat the comfort food like chips and all processed. In fact, the cereals and a lot of the promoted cereals in the television for the weight loss, they also are high glycemic. So people keep on picking that, but there's a chances that glycemic index is high and might not be losing the weight, you are gaining weight in fact. So it is very commonly seen that if somebody's mood is low, the appetite also changes, and you feel good. When you eat a lot, you feel good, and that also leads to emotional eating, and that no should be considered when there is obesity. There is a frequent misconception about the diet, but mostly it is seen that when you do the dieting, there is a very high chance of rebound weight gain. And that happens because body is not able to understand, because body has the mechanism to restore the food when the body understands that it is stopped. So once you are dieting, body is not able to understand that food is not available because of dieting or because of actually the starvation. So it stores that low carbohydrate, and there is more muscle wasting in fact, so that energy can be there. So these factors are there in terms of the stress and mental health. So that also should be considered. To manage the stress precipitated weight gain, I would suggest 4-letter word, that what we call CALM, calm. Calm means connectivity, both emotional and social. A means activity, physical activity, mental activity. You have to be active in fact, so that more calorie can be burned. And L is learning new things, so that if you are active, you will learn something new. And the last is M is mindfulness. That means focus. Mindfulness does not mean meditation. If you are focused on anything, that means no, you are focused and your health is good.
अभी जैसे डायरेक्टर सर ने बात की कि ओबेसिटी इज़ अ ग्रोइंग प्रॉब्लम ऑफ आवर कंट्री एंड ग्लोबली ऑल्सो, और 56.4% ऑफ जो डिजीज़ बर्डन है इंडिया का, इट इज़ रिलेटेड टू अनहेल्दी डाइट्स. तो यू कैन थिंक अबाउट द intensity of the problem which we are facing, and India being a young country, our population is young, so it is very important that we take care of the diet, what we are eating. And coming on first, what India is eating today. इंडिया में हम अभी हमारी पॉपुलेशन क्या खाना खा रही है. जो हमारा रिसर्च जो स्टैटिस्टिक्स है वो बताता है कि जो खाना हमें नहीं खाना चाहिए वो खाना हम ज़्यादा खा रहे हैं. जैसे कि सीरियल्स की अगर हम बात करें तो एक होता है रिफाइंड सीरियल्स, एक होता है कॉम्प्लेक्स कार्बोहाइड्रेट्स वाला. रिफाइंड में आ जाएगा मैदा, सूजी, ऐसी वाली चीज़ें, और कॉम्प्लेक्स में आएगा मिलेट्स हो गए, होल ग्रेन्स हो गए. तो अभी जो इंडिया की इंडिपेंडेंस हुई उसके बाद में हमारा जो मेन रोल था उस टाइम पे जो गवर्नमेंट का, वो ये था कि वी हैव टू फीड द पॉपुलेशन. इसलिए राइस एंड व्हीट को एम्फेसाइज किया गया उस टाइम पे. लेकिन उस टाइम पे हम भूल गए कि मिलेट्स जो है, जो स्टोर हाउस है, पावर हाउस ऑफ न्यूट्रिएंट्स है, उसको हम पीछे भूल गए. तो हमें ये ध्यान रखना है. अब लेकिन जब ये वाली बीमारियां जो लाइफस्टाइल रिलेटेड डिजीजेस प्रॉब्लम्स की इंटेंसिटी बढ़ गई, देन वी रियलाइज कि नहीं, हमें मिलेट्स खाना है. और इसी को देखते हुए हमारे डायरेक्टर सर की गाइडेंस में हमारे यहाँ पे मिलेट्स कैंटीन भी स्टार्ट की गई. सो आवर स्टाफ दे आर एंजॉइंग मिलेट इन ड्यूरिंग द लंच टाइम ऑल्सो. सो एक तो ये बात है, दैट इज़ वेरी इंपॉर्टेंट. अनदर थिंग इज़ कि जो अगर हम किसी की डाइट को देखें पूरे दिन की, our day starts with a processed food, because we begin our day with tea and biscuits. Biscuits is a ultra processed food. It is made of maida, sugar and saturated fat. हमें तीनों चीज़ें नहीं खानी है, हम वही जो है सुबह की शुरुआत कर रहे हैं. तो स्टार्टिंग ही हमारी सही नहीं है. तो इसके बाद में अगर हम सीरियल्स के बाद में आते हैं पल्सेस पे, तो हमारे यहाँ पे क्योंकि राइस एंड व्हीट पे ज़्यादा जोर रहा, इसलिए हम पल्सेस को थोड़ा कम खाने लग गए. मतलब जनरली जो भी वर्किंग लोग हैं दोपहर में रोटी और सब्जी ले खाते हैं, और डिनर टाइम पे रोटी और दाल खाते हैं. तो बट उसमें ये हुआ कि जो हमारी प्रोटीन है इनटेक, वो इंडियंस की थोड़ी कम है. तो हमें प्रोटीन पे ज़्यादा एम्फेसाइज करना. इट इज़ वेरी इंपॉर्टेंट दैट प्रोटीन को ज़्यादा खाएं. और प्रोटीन को भी खाने के बहुत सारे तरीके हैं, और जैसे स्प्राउटिंग करके, जर्मिनेट करके, भुने चने तो खाते ही हैं, लेकिन अंकुरित दालें, चने, उसमें जो न्यूट्रिएंट्स का लेवल है वो मल्टीपल टाइम्स इंक्रीज हो जाता है. विटामिन सी, बी कॉम्प्लेक्स, जिंक, सेलेनियम, ऑल द न्यूट्रिएंट्स वी गेट फ्रॉम दैट. इवन इससे आपके सटाइटी, फाइबर भी आपको मिलेगा. तो आप अगर हम ओवरवेट को टारगेट कर रहे हैं तो इसमें स्प्राउट्स खाने से हमें भूख कम लगेगी, तो सटाइटी वैल्यू भी ज़्यादा है इसके अंदर. तो हमें ये भी सोचना है कि हमें फूड ग्रुप को खाना कैसे है. इसके बाद हम बात करते हैं मिल्क प्रोडक्ट्स की. तो इसमें भी बहुत सारे वेरिएशंस हैं. मिल्क आजकल वी गेट इन ऑल काइंड ऑफ फैट कंटेंट. इफ़ यू वांट स्किम मिल्क, लो फैट, टोन मिल्क, सारे वेरिएशंस हैं. और अगर हमें फैट कम करना है तो गो फॉर टोन मिल्क और डबल टोन मिल्क. बिकॉज जैसा कि हमारे फैट इज intake of fat is very important. It should not be more than 30% of total caloric intake. अगर कोई अराउंड 1600 कैलोरी डाइट ले रहा है, जो नॉर्मली एक एडल्ट की है सेडेंट्री लाइफस्टाइल में, तो 20 ग्राम से ऊपर ऑयल नहीं होना चाहिए. तो ये वाला जो मिल्क का फैट था, ये इनविजिबल फैट था, हमें दिखाई नहीं दे रहा. कुकिंग ऑयल का तो हम समझते हैं कि हमने 1 चम्मच तेल खाया, 2 चम्मच तेल खाया, लेकिन ये तेल, ये जो फैट है, हमें दिखाई नहीं देता. तो इसको भी हमें कंट्रोल करना है, जो इनविजिबल टू द आई है. दैट इज़ ऑल्सो इम्पॉर्टेंट. और जो इंडियन डाइट है वो जो है लो इन मिल्क एंड मिल्क प्रोडक्ट्स है. सो वी नीड टू इंक्रीज आवर intake of milk and its products also, along with curd. Curd is an excellent probiotic. जो घर में हमारे स्ट्रेन्स हम बनाते हैं, उसका वो जो है उसको ले सकते हैं. मार्केट में बहुत इजीली मिल रहा है आजकल. इट कैन बी टेकन एज अ स्नैक रादर देन टेकिंग एनी फ्राइड फूड लाइक समोसा, कचौड़ी, ऐसी चीज़ें खाते हैं. उसकी जगह एज अ स्नैक लेना है तो मैन कैन टेक अ पैक ऑफ लो फैट कर्ड फ्रॉम द मार्केट. और इसके बाद में हम बात करते हैं फ्रूट्स एंड वेजिटेबल्स की. सो इवन fruits and vegetable intake of our Indians is very low. So we need to increase our intake of fruits and vegetable, and it should be 400 grams per day. One fruit, 100 grams. So around 500 grams in a day. There is plenty of evidence in literature which suggests that intake of more than 4 servings, 400 grams से ज़्यादा अगर हम vegetables खाते हैं तो उससे हमारा वेट लॉस होगा. क्यों? क्योंकि उसके अंदर फाइबर है. सो आवर सैटिस्फैक्टी विल बी मोर. तो उससे भी फ़र्क पड़ता है. और उसके बाद में ऑयल की बात करें. ऑयल इज़ वेरी इंपॉर्टेंट. जैसे अभी थोड़ा सा हमने मिल्क में बात करी थी ऑयल की, तो ऑयल का जो है वैरायटी एंड मॉडरेशन. जो भी ऑयल्स हम खाते हैं वो चेंज करके खाने. एक तरीका का तेल नहीं खाना है, और कंबाइन करके खाएंगे तो ज़्यादा फ़ायदा है, क्योंकि उनकी जो फैटी एसिड कॉम्पोजिशन है किसी भी ऑयल की परफेक्ट नहीं है. इफ़ वी आर मिक्सिंग 2 काइंड्स ऑफ ऑयल, क्योंकि ऑयल 3 तरीके का है, उसके अंदर फैटी एसिड्स है, सैचुरेटेड, मोनो अनसैचुरेटेड एंड पॉली अनसैचुरेटेड. तो मोनो अनसैचुरेटेड जो है वो थोड़ा ज़्यादा होना चाहिए, क्योंकि उसमें ऑक्सीडेशन कम होता है. तो उसके लिए ये है कि जैसे अगर आप मस्टर्ड ऑयल है, पूरे इंडिया में सभी लोग खाते हैं, उसके साथ में सोयाबीन ऑयल कंबाइन कर लिया. अगर किसी के घर में 2 किलो की रिक्वायरमेंट है, देयर आर 4 पीपल इन द फैमिली, ½ kg पर पर्सन पर मंथ. सो 1 kg ऑफ वन सोर्स ऑफ ऑयल and another 1 kg from another source of oil, and prefer locally available oils. If a person is staying in South India, go for gingerly oil or cottonseed oil, rice bran oil. और जो नॉर्थ में रहते हैं तो मस्टर्ड ऑयल बहुत अच्छा है, महाराष्ट्र में है तो ग्राउंडनट ऑयल बहुत अच्छा है. जो जहाँ पे रहता है वो वाले ऑयल्स को प्रेफर करेंगे तो वो ज़्यादा अच्छा है उसके लिए. लेकिन quantity is also important and quality is also important for oils. This is very important. और इसके साथ साथ में जो अनदर कंसर्न इज नाउडेज लॉट ऑफ पैकेज फूड इज़ अवेलेबल और उनमें न्यूट्रिशन क्लेम्स होते हैं। न्यूट्रिशन क्लेम्स का मतलब उसमें लिखा होता है कि ये वाला ऑयल इज़ कोलेस्ट्रॉल लोअरिंग, हार्ट फ्रेंडली, ये जो फ्रूट है ये रियल फ्रूट जूस है, ऐसे वाले क्लेम्स होते हैं, शुगर फ्री। बट इफ़ यू रीड द लेबल केयरफुली यू विल फाइंड कोई भी प्लांट बेस्ड ऑयल है कि उसमें कोलेस्ट्रॉल नहीं होगा, तो वो क्लेम जो है ना वो करेक्ट नहीं है, वो मिसलीडिंग मार्केटिंग है। तो इसके लिए मतलब ये है कि वन हैज़ टू रीड द लेबल प्रॉपर्ली, फूड लेबल को प्रॉपर्ली पढ़ना है। और ऐसे ही एक यूएसए में स्टडी हुई थी, स्कूल के बच्चों को उन्होंने पढ़ाया कि हाउ टू रीड अ फूड लेबल। फिर उसके बाद उन्होंने एसेस किया कि उनकी डाइटरी हैबिट्स में चेंज आया, क्योंकि आजकल बहुत सारे फूड जो है वो पैकेज होता है, तो उन लोगों की हेल्दी वो खाने से पहले फूड लेबल को पढ़ने लगे। तो जब हम ऐसा करते हैं तो हमारी जो ईटिंग है वो हेल्दी होगी। सो रीडिंग अ फूड लेबल इज़ ऑल्सो वेरी इंपॉर्टेंट। जब हम ओवरवेट और ओबेसिटी की बात करते हैं तो एक तीसरी चीज़ जो थर्ड में स्ट्रेस देना चाहती हूँ, फैट डाइट्स का बहुत आजकल इम्पोर्टेंस दी जा रही है कि समथिंग लाइक अ मैजिक बुलेट, कि आपने ये फूड खाया तो आपका 1 महीने में 4 किलो वेट कम हो जाएगा, 2 किलो कम हो जाएगा। ये क्लेम्स आजकल काफ़ी सारा होते हैं, लेकिन आप वन हैज़ टू कीप इन माइंड दैट डाइट तो रोल प्ले करती है, साथ में आपका लाइफस्टाइल कैसा है, आप कितनी फिजिकल एक्टिविटी कर रहे हैं, वो भी इक्वली इम्पॉर्टेंट है। तो इट इज़ नॉट दैट कि ईटिंग पर्टिकुलर, जैसे ग्रेप फ्रूट डाइट होती है, कुछ लोग कहते हैं बॉइल्ड एग डाइट, कैबेज सूप डाइट, ऐसे सो मेनी डाइट्स दे आर वेरी कॉमन दीज डेज। सो डोंट फॉल प्रे टू सच काइंड ऑफ डाइट्स, फॉलो हेल्दी डाइट। आपकी कैलोरिक इंटेक आपकी बॉडी के हिसाब से होनी चाहिए, एम्प्टी कैलोरीज नहीं लेनी है, जैसे कार्बोहाइड्रेट बेवरेजेस हैं, चिप्स हैं, फ्रेंच फ्राइज़ हैं, ऐसी चीज़ों में कोई न्यूट्रिशन नहीं है। हमें जो भी खाना है वो न्यूट्रिएंट डेंस होना चाहिए, और कोशिश करके जितना भी नेचुरल और रॉ फूड आइटम खाएंगे वो हमारे लिए ज़्यादा अच्छा है। और जब हम तेल की बात करते हैं, एक तो मैंने अभी बताया विजिबल ऑयल, इनविजिबल ऑयल, और तीसरी चीज़ इम्पॉर्टेंट है नट्स एंड सीड्स की। तो जिस जगह पे जिस सीज़न में जो भी नट्स एंड सीड्स मिल रहे हैं, गर्मियों में खरबूजे के बीज हैं, वो चलते हैं, अभी तिल के बीज चलते हैं, तो जब आप खाएंगे तो इससे भी आपको फैट मिलता है, और ये हेल्दी फैट होता है। और एक चीज़ जो बिल्कुल अवॉइड करनी है वो है ट्रांस फैटी एसिड्स, जो रिपीटेड फ्राइंग करते हैं जब हम ऑयल में, और उस बेकरी प्रोडक्ट्स में भी यही वाला फैट यूज़ होता है ज़्यादातर, तो उसको अवॉइड करना है। क्योंकि अगर हम वो वाला फैट की बनी चीज़ें खाएंगे, ट्रांस फैट की, तो हमारे जो लिपिड प्रोफाइल है वो चेंज हो जाएगी। जो हमारा HDL है, अच्छा वाला लिपिड है, वो वाला तो कम हो जाएगा जो हमें बढ़ाना है, और जो VLDL है, LDL है, वो इंक्रीज हो जाएंगे। तो ट्रांस फैट, ट्राइग्लिसराइड्स भी बढ़ जाएंगे। सो ट्रांस फैट्स आर टू बी टोटली अवॉइडेड, एंड मोस्टली समोसा, कचौड़ी, भटूरे, ऐसी चीज़ों में होता है, उससे हमें बहुत ध्यान रखना है कि हम ऐसी चीज़ें नहीं करें, और कोशिश करके फूड्स को स्वैप करके खाएं। हेल्दी ईटिंग का ये कॉन्सेप्ट है कि अगर फ्रेंच फ्राइज़ नहीं खाइए, कैरेट की स्टिक खा सकते हैं सर, और जो स्टीम करके इडली खाइए आप, कचौड़ी नहीं खाइए, ऐसे इस तरीके से आपको करना है। जूस नहीं पीना, फ्रूट खाना है, क्योंकि फ्रूट खाएंगे तो एक खाएंगे, जूस पिएंगे तो 4-5 मौसमी लेंगे, तभी आपका एक ग्लास बनेगा, और फाइबर भी निकल जाएगा, तो उसका कोई फ़ायदा नहीं। तो इसका मतलब यही है कि द मोर वी गिव एजुकेशन टू आवर पॉपुलेशन, तो वो अडॉप्ट कर सकें हेल्दी ईटिंग को। और ये फैमिली में भी होना चाहिए, स्कूल बेस्ड प्रोग्राम्स भी होने चाहिए। और जो हाई फैट, सॉल्ट और शुगर की प्रॉब्लम है, इसको काउंटर करने के लिए हमारी गवर्नमेंट भी आजकल इसमें काफ़ी वो काम कर रही है। तो टुगेदर आई थिंक वी विल बी एबल टू इसको हम कर पाएंगे, टैकल कर पाएंगे. थैंक यू वेरी मच.